Welcome back to Ozarks Tonight. As states across the U.S. continue to reopen, the number of positive COVID-19 cases are on the rise, and some are asking what the federal government should do if infections continue to increase. Our political analyst, Dr. Brian Calfano, is joining us on the program today. Brian, thanks for being here. What should the federal government be planning for right now if the cases of coronavirus continue to spread?
Well, let's put this in perspective for most folks. I think the reason why you see on our social media pages a lot of times people saying this is no big deal, you know, you just get it and it's done, herd immunity, all the sorts of things that you might see people who are, let's say, skeptical of COVID as a medical threat say. You see that because statistically, even though there are over 2 million positive cases and if you believe the way that they count, over 100,000 deaths at this point. We are a nation of 320 million people. So it's very possible to, within your social network, in the circles you run in, not encounter anyone who had COVID, or if they did have it, they didn't have a severe case. So your reality, your frame of reference is such that you're able to just dismiss it. The difficulty for the federal government, for policymakers, all the way up to President Trump, is that we are just at the beginning of this saga. I think the very best case scenario with this Project Warp Speed that the federal government instituted a few months ago to try to get to a vaccine, you know, the most recent example of a fast, quote unquote, rush to a vaccine was the measles vaccine that took about 4 years to develop, test, and get out to the public. 4 years. Now, even if we cut that in half, we're still looking at 2021 before we'd have a vaccine. Meanwhile, you see, as you said, John, these increasing cases going up, including places like Florida, where the president wants to hold the last half of the Republican National Convention at the end of August. That is just under 2 months from now. And when you see 10,000 new cases of COVID per day, and you end up seeing that a percentage of those cases are severe, meaning people end up in the hospital, and you see what's going on with the ICU bed capacity in some of these areas, then it becomes very dicey from a policy standpoint to just say, well, we're going to ignore this and let it run its course and let people get immune to it and hope for the best. There needs to be a reckoning, I think, in terms of what's going on the ground in these states, these critical states, really, for President Trump in this re-election bid that he is waging, and what's happening in the White House in terms of policy. And I think there's a reason why we saw for the first time in several weeks the coronavirus task force come out last week, I should say, with a press conference. And the situation there is that, you know, they're trying to be on top of this, but I think we're now getting to the point, as Anthony Fauci said, where we've let the horse out of the barn, where you basically are going to watch an out-of-control spike in cases. And so does that mean that we go to a shutdown again across the country? That's very unpopular for most people. But I got to tell you, if you end up seeing the kinds of cases that they saw in New York, where you've got people who need to be intubated and they're in ICU and there's not enough capacity, I mean, it is not like anything we've faced in this country in over 100 years.
Should there be cause for concern regarding these increases in COVID-19 cases for President Trump's re-election bid, especially when it pertains to the swing states?
Oh, certainly, because as I said, we just don't know the percentage of these new infections that will be severe. If people end up being asymptomatic by and large, particularly those folks who are inclined to support President Trump, if they look at this and say, it's no big deal, then I think he can survive, and I think he may even have a shot of winning in November. Remember, a lot of this is also dependent on how good of a candidate Joe Biden is, and traditionally Joe Biden has not been a good presidential candidate. It's just the facts. So we've yet to see much out of Biden because so much of the air in the room from a media perspective has been taken up by the president in his response to COVID. But certainly there's no way for the president or his team to predict how these infections will turn out. It's not just the numbers, it's the severity. And if you end up seeing some high-profile cases of people who are not able to get the health care they need, and they're in these critical states for the president, like Arizona, like Florida, like Texas, where you see the skyrocketing cases, that is going to have an impact. There's only so much people are willing to give in terms of slack to their preferred candidate if they think their lives are on the line. If their lives are on the line, then this is a very difficult situation for the president. And it might just be, he's just unlucky in terms of the timing of all of this. Because again, COVID is not something he produced, it's not his direct fault that there's COVID going on. Now, you could argue that, well, different ways of mitigating the issue, and you could have had more of a response early, et cetera, et cetera. But all of that now is over. I mean, we have COVID. We have the largest number of cases. We are continuing this uptick. We are unlike any other country on the planet in terms of the percentage of our population that continues to fall prey to this virus. And so it's not going to go and fade into the background. I don't think anybody can assume that. And if you're the president, I think you kind of have to come up with a way to thread this needle. And if I were giving him advice, I'd say, Mr. President, look, you're going to have to go to the American people and enlist their help and say, look, masks work. They lower the probability of you transmitting the virus to somebody else. There's something we can all do to be involved in this, to fight back against this, and to lessen the burden on our healthcare workers who are performing miracles on a daily basis, but there's only so much they can do. I think the president needs to turn this into a positive for him. His inclination to ignore this and to downplay it is not going to bode well for him, because Joe Biden and the Democrats are going to be able to say, look, he's out to lunch, he doesn't know what he's doing, he's not taking this seriously, he's not an effective leader. The president has to confront this and do more in terms of getting Americans behind the effort to curtail it. That's been something he's not been as willing to do in his public statements. He's had other folks in the administration, namely Vice President Pence, talk about these sorts of measures. But the president himself has been sort of loath to do that. I think he would be best served to pivot in his rhetoric and talk about mitigation and how everybody can play a part. He may even have to start wearing a mask, but you could certainly see a MAGA mask on the president. And everybody, I think, could imagine that happening. Why not? If it saves his presidency, if it gets him reelected, I'm not sure why he'd be resistant to the idea. But we're in uncharted territory here, John. So in terms of what the president does and how the country reacts is something we'll have to wait and see as all this unfolds.
We definitely will have to wait and see, and the president has a little more than 4 months to make an adjustment to his strategy here. Dr. Brian Calfano, thank you so much for joining us on the show today.
Thanks, John.
We'll be back with more Ozarks Tonight right after this.